Moving towards our next topic, that is AIDS and TB fight, Tamil Nadu shows the way again. The context of this topic is that a write-up has appeared in today's the Hindu newspaper in the form of one of the editorial, and that is focusing on the major challenges associated with the rising burden of the TB and AIDS in India, and how exactly with the innovative methods Tamil Nadu is showing the way to other states and to India also. And this particular topic is related to your GS paper 2 health. Let's first try to look into some of the basics of tuberculosis and AIDS. So tuberculosis, which is a bacterial disease caused by the bacteria Mycobacterium tuberculosis, and the transmission of this bacteria happens with the airborne infection, that is mainly spreads with the close contact with the infected person. If the person is coughing, sneezing, etc., this airborne infection can happen. Also, that it is completely curable disease, the treatment is possible, and 6-month course is there for antimicrobial drugs. One of the course is DOTS, etc., which is a 6-month course, and if people will complete this antibacterial drug course, this particular tuberculosis can be eliminated. Majorly it impacts the lungs of the person, but it can also impact other organs of the person. Also, with regard to the India TB report that came, estimated TB case in 2020 were around 26.9 lakh. In 2023 it increased to 27.4 lakh, and it further increased to 27.8 lakh in 2024. And if you see the estimated mortality, 3.2 lakh was the mortality that was with regard to the tuberculosis, that was because of the tuberculosis. And again, one of the major issue is that around 25% of the global TB infections are happening in India itself. And that is one of the reasons that we need to have a proper policy, sound policy, to ensure that we are able to tackle this burden. Then AIDS, that is acquired immunodeficiency syndrome. So majorly this HIV, which stands for the human immunodeficiency virus, after entering the body, they gradually destroys the immune system, for example CD4 cells, etc., and that reduces the ability to fight infections or the diseases of the person. And this can evolve into AIDS, that leads to the weakening of immune system, and then it is not curable at all. What are the modes of transmission? Unprotected sex with an HIV infected person, transfusion of HIV infected blood or blood products, sharing of needles which are contaminated with HIV infected blood, or from HIV infected mother to her baby during pregnancy, breastfeeding, etc. So with the bodily fluids, this HIV can be transferred. Now this human immunodeficiency virus is a virus that can lead to AIDS, and it gradually, both these gradually attacks and weakens the system. And this AIDS is the later stage of untreated HIV. For example, antiretroviral therapy is there, which is a group of drugs which are generally given to the HIV patients. So the impact can be reduced, however it is not 100% curable. Also, the group of signs and symptoms that emerged as the immune system weakens, for example, people generally gets infected with other kind of diseases because their immune system has become very weak. Now let's try to understand what are the major challenges with tackling TB in India and then with AIDS in India. First of all, the high burden, huge amount of patients that are in India, and with the limited number of health centers in India, for example primary health care centers, and what is the community health care centers number with regard to the recommended health centers. For example, primary health care facilities, it is around 27,661, whereas this is the recommended number, and the current primary health center are 23,236. But moreover, the availability of the doctors, a proper mechanism to track all the patients who are taking the DOTS or who are taking the medicines of the TB, that is not readily available. Then with regard to the community health care centers, the recommended numbers are 6,692, but again current number is around 3,346. And if you see that India has around 27%, 25 to 27% of burden, and total number of people who in the world who are suffering from tuberculosis is 1 crore. In India itself, it is around 26.9 lakh. And it is also one of the important diseases because of which the mortality or the deaths of the people are happening. Plus drug resistance, that is multi-drug resistant TB, that if a person who needs to complete his 6 months of course, for example rifampicin is there, isoniazid is there, which are the antibiotic drugs which are used to treat the tuberculosis. But if the person is not aware that they need to complete the 6 month of course and they leave the course in midway itself, there are chances that that tuberculosis bacteria will become resistant to antibiotic drugs. Also, limited access to healthcare because of the poor doctor-patient ratio, because of the poor availability of the primary healthcare center and community healthcare centers, because of the high cost that is involved in the private sector, because of the high out-of-pocket expenditure, because of high poverty. For example, multidimensional poverty index 2024 says that multidimensional poverty headcount ratio is around 11.28%. Also, the stigma and the discrimination, that if a person is already having the TB, they have a feeling that if they will share this in the public domain, people will start ignoring me, or people will not interdine with me, people will not handshake with me, people will not spend time with me. And despite knowing that they are infected with TB, they continue with that. And whenever they cough, sneeze, etc., the infection further infects other persons in that vicinity. Also, poor living conditions, for example, with the rural and urban migration that we are witnessing, because of the better facilities in the form of better employment opportunities, educational facilities, health facilities that are available in the urban areas, we are witnessing the flux of migrants. But again, there is a limited amount of infrastructure that is available which can sustain population properly in the urban cities. So whatever the urban sprawl that we are witnessing, that is compromising the living conditions. For example, even the basic necessities are not getting fulfilled in the form of potable water, in the form of better sanitation facilities. People are living in slums. For example, this is the data with regard to the number of slums which are there in major cities, for example, Delhi, Meerut and Mumbai, etc. And also we need to understand that these people are construction workers, for example, daily wage workers, etc. And whenever a particular disease happens, their work will also be compromised. So because of these poor living conditions, the chances of thriving of this TB bacteria becomes much higher. Also, the limited awareness with regard to the TB disease, the importance of completing course. For example, whenever person starts taking antibiotic drugs, the symptoms subsidizes. People start, the coughing, etc. reduces, and people just think, they presume that they are already 100% cured. And that is the reason this multi-drug resistant TB, etc. is becoming prevalent in Indian society. Also, the challenges with regard to the AIDS in India. For example, the late diagnosis and low testing coverage. And that shows the hidden burden. For example, whenever a person is having unprotected sex, as a normal human being, the people should know, or people generally knows, that unprotected sex can lead to the AIDS or HIV. But even after that, they do not go for regular checkups. Or even if a person is, let's suppose, is a drug addict and they know that they are using syringes, etc., even knowing that, they don't go for the regular checkups. So because of which there is a high burden that we are witnessing. For example, around 30% of people who are living with HIV in India, they do not know their status, as per a survey which is done by Ministry of Health and Family Welfare. Also, the social stigma and discrimination associated with this. Although there are various awareness campaigns that are run by the government, that by interdining or by shaking hands with the person who is infected by the AIDS, HIV will not spread at all. But despite that, there is a stigma associated with the disease, discrimination associated with that. And because of these socio-cultural barriers, there are fear of isolation and social rejections, because of which people avoid sharing this information that they are infected by HIV, and there may be a case that may further infect other persons. Also, gaps in treatment coverage and drug resistant. For example, antiretroviral therapy or antibody treatment which is available for HIV, that is not available in the major hospitals of India. For example, the vaccines are not available for HIV, but again antibody treatment is given, but that is costly. That is not available in the majority of the semi-urban and rural areas. And around 1.4 million people are on antiretroviral therapy, but because of the high cost that is involved, because of the poor availability in the public hospitals, a high dropout rate is witnessed, and that HIV will further turn into AIDS, and which can be life threatening. Also, high vulnerability of the key population gap, that there are some concentrated epidemic. For example, you'll see the districts in Punjab, in northeastern states, where the drug abuse is very high, drug use is very high. Those are the areas or the cities where the HIV prevalence is also very high. Also, if you see this India TB report and World TB Day 2025, if you see the TB HIV co-infection, that 54,000 new TB cases each year among the people who are living with HIV. Why? Because whenever the HIV is there, it will reduce the immune response of the person. The capability to fight with the TB infection will reduce, and that will make this person more susceptible to get infected with the tuberculosis. 11,000 TB related deaths are happening annually in the HIV positive individuals. That with the reduction in the immune response and immunity of the person because of the HIV infection, the chances of getting TB is much high, and that is also causing death of the person. Also, funding constraints and programmatic gaps that are there. For example, resource limitations is there with regard to the various therapies that are available, awareness campaigns that are available. The limited budgets are available with the state healthcare departments or the hospitals, etc. For example, states has time again and again reported that they are stock out of the testing kits and antiretroviral medicines that are given, group of medicines that are given to HIV infected persons. When there will be a poor supply of these medicines, for example, CoWIN portal was being used for tracking the supply of the vaccines, COVID-19 vaccines. If similar kind of portal can be developed, which can track the testing kits, the availability of the testing kits, availability of antiretroviral medicines or other important medicines which are important for human health, then we can ensure that we will be able to provide them at a timely manner, and that can ensure that mortality is very less. What are the government initiatives to tackle this burden of tuberculosis and AIDS? For example, Pradhan Mantri TB Mukt Bharat Abhiyan, which is providing nutritional support. It is also providing better access to diagnostic and treatment of the person. Also, there are government approved BAPLM regimen, and it is your duty to pronounce these 4 medicines which are given together to treat the tuberculosis. One is bedaquiline, then we have the pretomanid, then we have the lenozolide and moxifloxacin. Okay. Also, there is national strategic plan that is ensuring quality diagnostics, treatment and support to every TB patients. For example, target for India is to eliminate tuberculosis by 2025, whereas global target is 2030. Also, the free of cost diagnostics and treatment which is being provided with the help of anti-TB drugs to all the TB patients, and this RNTCP, that is Revised National Tuberculosis Control Program. Then also the Nikshay Poshan Yojana, which is again under this national strategic plan, that provides incentives in the form of 500 rupees per month for each notified TB patient, so that these people can complete their duration of anti-TB treatment, and also the incentives are distributed in cash as well as direct benefit transfers are given, so that their nutritional needs can be fulfilled based on that direct cash transfer. Also, for example, this for AIDS, there is this NACPV, that is the National AIDS and STD Control Program. So here what is happening, the targeted areas are there where government is focusing on the operational target, which includes aiming 95 coverage, that is 95% of people who are at risk use prevention, 95% of HIV positive know their status that they are infected by HIV, 95% of those who are on treatment, and 95% of those achieve viral suppression. And also for pregnant and breastfeeding women living with HIV, ensuring suppressed viral to enable elimination of vertical transmissions that generally happen from pregnant to the newborn child. Also, the target is to reduce the annual new HIV infection by 80% from 2010 baseline. Also, reduce the AIDS related mortalities by 80% from 2010 baseline. Also, to eliminate the vertical transmission which we have discussed from mother to child, which generally happens at fetus. And then also to promote universal access to quality antiretroviral therapy and testing kits, etc. to the vulnerable population. We also need to eliminate the stigma associated with that, discrimination associated with that. There were various campaigns, etc. that is being generally done by the Ministry of Health and Family Welfare, as well as various state related interventions are also there. For example, Tamil Nadu's model, that is Tamil Nadu State AIDS Control Society, which took various interventions which has yielded better results. If you see the how exactly Tamil Nadu started the AIDS program, so from 1992, National AIDS Control Project was launched with the support from World Bank, but the major issue was the fund flow from the World Bank was very slow that has reduced the effectiveness of this program. In 1994, Tamil Nadu converts the state AIDS cell into Tamil Nadu State AIDS Control Society, which is one of the registered society, which has enabled direct funding, and also it provided various autonomy with regard to the various decisions and various initiatives that they can take. Also, the impact was that there was various rapid awareness campaigns which were launched. For example, there are various state level online quiz competitions which are generally done by this society itself, that further increases the awareness of the people, and because of which because of this kind of interventions, there was sharp fall in new infections, and Tamil Nadu no longer is one of the HIV hotspot. From 1997 to 2002, model was replicated nationwide, and because of which India's HIV prevalence declines from 0.5% in 2000 to 0.22% now. So what is path ahead? What should be done to control this dual burden as well as to control the burden of HIV as well as tuberculosis? First of all, we need to engage better with the private hospitals and the chemists. We need to provide them with testing kits properly. Plus, we need to give them proper training at regular interval to ensure that they are getting an idea about the antiretroviral therapy that is available. Along with that, some of the better hospitals can be equipped with antibodies treatments that are available for the HIV. Also, there should be a proper tracking mechanism oversight for the patients who are on these therapies or who are on the antibiotic drugs for the tuberculosis. Also, we can leverage the contact with the rural medical practitioners, because in COVID-19 itself, during COVID-19 itself, you see people who are coming from the rural background would relate with the fact that azithromycin, Dolo 650, Calpol 500, etc. were the medicines which were being recommended by these medical practitioners, these chemists which are there in our local markets. There is lack of availability of the qualified doctors, plus hospitals were already flooded and there was a risk of infection from hospital also. That was the reason people started taking medicines from these rural medical practitioners as well as chemists which are available. So if they will have the complete information about what are the symptoms related to tuberculosis, symptoms related to HIV, they can give the correct information that where they should go for the testing, where they should go for the treatment. Then again we can reduce the prevalence of this tuberculosis and AIDS. Also, there is need for effective implementation of ongoing programs. We need to do a proper audit. We need to see that what are the issues, and we need to plug those gaps which are there in the ongoing programs. Also, there is need for investment in research and development. For example, there are various research going on with regard to the antibodies treatment for the HIVs. But again, with the new researches that are happening, it is giving an idea that with regard to different strains that are there in different regions of the world, that response to antibodies is again different. For example, recently M21 matrix vaccine is there, which is being manufactured by Serum Institute of India for malaria. So India should focus on research and development. India's spending is only around 0.6 to 7%, and majority of which is again coming from the government itself. So if we'll focus on research and development, we can come with some of the novel solutions for the this kind of tuberculosis and AIDS as well as HIVs. Also, there is need for awareness generation. We need to dismantle the stereotyping associated with these diseases. Prevention is important. Taking due diligence while dealing with those patients is important. But again, stereotyping should not be there. Discrimination should not be there. This is a mains practice question that you people can write from this particular topic.